The temporomandibular joint, or TMJ, also known as the jaw, is something that chiropractors can treat very well in office. This is going to affect people with headaches, people that clench throughout the night, even people with just regular neck pain because of the muscles that are associated with the jaw as well. The sternocleidomastoid, or the clenching muscle in the front, attaches up into the jaw and the mastoid process. We also have some scalenes that are involved, which are muscles in the side of the neck, as well as the actual facial muscles. So what we can do is a nice little pin and stretch of those muscles. We can do a little bit of myofascial stripping, and then we're going to use a tool called the activator in order to go in and adjust some of those joints in order to get people some relief there. TMJ is often associated with people who suffer from migraines or headaches as well because of the clenching and the stress and tension that it puts on in through the neck and the head. So this is something that we can treat very well in the chiropractic setting. When we treat TMJ in the office, we're going to start by assessing some of the neck musculature and in through the jaw. We're going to work on loosening that up a little bit, and then we're going to apply a little bit of a force in through some of those joints as it is tolerated by the patient in order to get things moving a little bit better. So here we're stripping some of the muscles in the anterior neck that attach up into the jaw to loosen things up prior to doing any adjustment. Then I'll often make some contact on some of these muscles. I'm going to have Krista open and close her mouth nice and slow. Good. And then we're going to use a tool called the activator, which is a very non-invasive method of adjusting from the outside. There are some internal methods where we can put gloves on and go in through the patient's mouth in order to assess some of the muscles that are within, but it's a little bit more intense and not as comfortable for the patient. So this is usually a very effective means of treatment, and if they can tolerate this and they experience some improvement, this is typically what we'll stick with. So I'm going to apply some force on the outside of the jaw here. Typically it's going to be on the side that's more restricted. And we're just going to do a little bit of activator here. You okay? Mm-hmm. And one more up at the temporal. Great. That feels okay? Mm-hmm. If you're someone that suffers from headaches that you associate with clenching, if you've been told you have TMJ by your dentist, if you feel like you have tension in your jaw, give our office a call today or visit us online and we can discuss your treatment options.